Hi, I'm Jenn Davis, and I am originally from Massachusetts. I grew up in New England. I did medical school in Atlanta at Emory University School of Medicine, and then I went to San Francisco in California at the University of San Francisco for my internal medicine residency. And then I went back to Massachusetts and did my infectious disease fellowship at the combined program at Massachusetts General Hospital and Brigham and Women's Hospital. When I was going through medical school, I loved every specialty. I really liked surgery when I was doing it. I loved neurology when I was doing it. Pretty much loved everything. And so oftentimes people who love everything end up in internal medicine. And I did that. And then in internal medicine, rather than subspecialize in one organ system and ignore the rest of the body, I really fell in love with infectious disease, where we get to do everything about the body and interact with every other specialty. So all of those other things that I was interested in, surgery, OB-GYN, all of that, you get to do in infectious disease as well, because infections affect all parts of the body. So in infectious disease, we see a lot of different conditions. Obviously, all infections, bacteria, viruses, fungal infections. But we also see a lot of non-infectious diseases that people think might be infections. So we pretty much see everything. For me in particular, I'm actually an HIV specialist, and I'll be working at the specialty care center, or I work at the specialty care center here at UNMC, and so I primarily see patients living with HIV as my outpatient patient population. I think that one of the most important things that we can do as doctors is to put patients at ease when we first meet them, because as a lot of people say, if you're coming to see a doctor or you're in the hospital, it's one of the worst days of your life, probably. And so the first time you meet me, most of the time, I'm going to ask you about you. I love getting to know my patients, getting to know where they're from, what their life's like outside of the disease that's affecting them at that moment in time. And especially if you come to see me in the HIV clinic, that's going to be a big part of our holistic care of you, is to get to know you as a person as well as your disease process. I knew right away that I wanted to stay at an academic medical center. I've been at an academic medical center throughout my career, in training and then in residency and in fellowship as well. And as well as my clinical role, I also do a lot of medical education, and that's primarily what I do outside of clinic. And so I knew that I wanted to be at an academic medical center, helping with teaching residents, fellows, medical students, also, other physicians with continuing medical education.